Imagine a small pebble, hidden deep inside your body, quietly forming without a sound. Most people never feel it. Some don't even know it exists. But one day, out of nowhere, a sharp pain grips the upper stomach. A pain so intense you can't speak, breathe, or move. That tiny pebble, a gallstone. Today, let's gently break down what gallstones really are, why they form, who gets them, what symptoms to watch for, and what treatments actually work. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Gallstones start with something very ordinary: bile. Bile is a greenish-yellow fluid made in your liver to help digest fats. Normally, it stays liquid, but sometimes the chemistry changes, and what should flow begins to solidify. Think of snowflakes forming in cold air. Tiny crystals appear in the gallbladder. Over time, those crystals grow and become stones. There are a few types. The most common are cholesterol stones, soft, yellowish stones that form when bile contains too much cholesterol. These make up nearly 90% of all gallstones. Then there are pigment stones, darker, harder stones formed from bilirubin and calcium. And mixed stones, a blend of both. Some people develop just one large stone, others form a handful, and some fill their gallbladder with dozens of tiny ones. Now let's see who gets them. Gallstones affect about 1 in 8 people at some point in their lives. They're more common in women, especially those who've had children. The risk rises with age, obesity, rapid weight loss, diabetes, liver disease, and digestive conditions like Crohn's. Hormonal medicines, such as birth control pills or hormone replacement therapy, can also increase the likelihood. And sometimes, it simply runs in families. Yet here's the surprising part. 4 out of 5 people with gallstones never feel a thing. Their stones lie quietly in the gallbladder, discovered only when a scan is done for another reason. But for the remaining group, the story becomes very different. Picture this. You eat a rich meal. Your gallbladder squeezes to release bile, but a stone blocks the tiny tube, the cystic duct, like a cork in a bottle. The gallbladder pushes harder and harder until the pain becomes unbearable. This is biliary colic, a deep, gripping upper abdominal pain, usually on the right side, just beneath the ribs. It may last minutes or hours. It may strike once or come and go over months. Sometimes the pain travels to the back or the shoulder blade. If the blockage triggers inflammation, the gallbladder can become infected, a condition called cholecystitis. Here, fever appears, nausea sets in, the whole body feels unwell. This usually requires hospital care, antibiotics, and often surgery. If a stone slips out of the gallbladder and blocks the main bile duct, bile seeps into the bloodstream, causing jaundice, yellow eyes, yellow skin, dark urine. And if a stone gets stuck where the bile duct meets the pancreas, it can inflame the pancreas, leading to pancreatitis, a serious, painful emergency. Even rarer complications include infection of the bile ducts, gallbladder abscess, bowel obstruction, and very rarely, gallbladder cancer. But how do doctors diagnose gallstones? Often the story of right-sided pain combined with tenderness in the upper abdomen gives the first clue. Ultrasound is the key test, painless, quick, and excellent at spotting stones. Blood tests check for infection, inflammation, or blocked ducts. In some cases, additional imaging is needed. When it comes to treatment, the rule is simple. If gallstones cause no symptoms, they're usually left alone. No medicine can reliably dissolve them once symptoms begin. But if the stones start to cause trouble, the most effective treatment is surgery to remove the gallbladder, a procedure called cholecystectomy. Most people have it done through keyhole surgery, which uses small cuts and a camera to guide the operation. A few need a traditional open surgery. Sometimes a stone gets stuck in the bile duct. In such cases, endoscopic procedures can remove it. In rare, difficult situations, laser techniques may be used to break the stones before removal. And what happens after the gallbladder is gone? Surprisingly, your digestion continues just fine. Bile simply flows directly from the liver to the intestine instead of being stored. A few people may notice mild bloating or looser stools, especially after fatty meals. But this usually settles with time. Every now and then, some people develop ongoing symptoms even after surgery, called post-cholecystectomy syndrome. Pain, indigestion, or jaundice may appear and require further evaluation. Before we close, here are a few common questions people ask. Can gallstones make you tired or dizzy? Not directly, but severe attacks or complications can make you feel drained or faint. Do they cause diarrhea? Not usually, unless a stone causes blockage or inflammation. What do gallstones look like in the toilet? If passed, they resemble tiny yellow or brown pebbles, sometimes jagged, sometimes smooth. Where is the pain felt? Mostly in the upper right abdomen, often spreading to the back or shoulder. The key takeaway? Gallstones form silently, and most remain harmless. But when symptoms appear, they should never be ignored. Early evaluation can prevent serious complications, and treatment is safe and highly effective. If you've been struggling with unexplained upper abdominal pain, especially after meals, you're not imagining it. Your body is trying to tell you something, and the sooner you understand it, the sooner you can take control of your health again. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.